Good afternoon, dear patients. Today we will discuss a case of a penile ulcer in an HIV-positive patient. A man came to us who initially concealed the fact that he was HIV positive and did not mention it. In general, we don't ask direct questions like, do you have an HIV infection? Accordingly, his complaint was about a relatively painful ulcer on the penis, the appearance of which you can see. The ulcer was covered with a rather thick crust. It was somewhat painful, or rather, not just somewhat, but quite painful, and red around the edges. In other words, there was inflammation around the ulcer. Accordingly, after a detailed interview with the patient and, well, in the process of determining the need for tests, it turned out that the man is HIV positive and is currently undergoing antiviral treatment at an AIDS center. And accordingly, he engaged in sexual intercourse despite this. About 21 to 22 days ago, he developed this ulcer quite recently, which is somewhat covered with scabs and is painful. So what was done? Well, first of all, there was no point in taking HIV tests. Comprehensive tests for syphilis were taken, which I can say right away turned out negative. Next, surface tests were also taken, a PCR test from the surface of the ulcer and a bacterial culture from the surface of the ulcer. What did they show? The PCR tests, of course, were taken not only from the surface of the ulcer, but also from inside the canal. Of all the sexually transmitted infections, only Treponema pallidum tested positive. So accordingly, this was syphilis. You might ask, why were the blood tests negative in this case? The fact is, it takes time for a blood test to become positive. The minimum time is 3 to 4 weeks or more. In HIV-infected patients, on top of that, the immune system is weakened, so antibodies are produced even more slowly. Therefore, after 3 weeks, it's only natural that the test is negative, and it should be. But here, it's very important to take samples from the surface of this particular lesion. If the doctors or the patient had relied solely on the blood test, if they had, so to speak, relaxed and done nothing, then this disease would inevitably have progressed to the secondary stage. You can watch a separate video on our channel about what the primary and secondary stages of syphilis are. So, why is there such a large scab? Why is there inflammation? Because firstly, Staphylococcus aureus was cultured. This Staphylococcus causes inflammation. Naturally, the body is weakened due to HIV infection, so the Staphylococcus causes inflammation. The Staphylococcus causes suppuration, which leads to inflammation around the chancre, resulting in pain and such a relatively large scab. What tests should be urgently taken in such cases? This is a swab from the surface of the ulcer to test for the syphilis pathogen and for the pathogen of all types of herpes as well. As for which tests to take for herpes, you can again watch a separate video on our channel, as well as other tests for sexually transmitted infections, considering that they can also have atypical presentations in HIV infection. This particular patient, with recommendations and a diagnosis of hard chancre, primary syphilis, was sent to the HIV center where he is being treated because he needs to receive treatment specifically at the place where his main disease is managed.